Okay, the recording has started.
Great. Thank you, Roberto. All right. Well, welcome everyone. If you are here for the American Nurses Foundation informational call on the next phase, the Reimagining Nursing Initiative, you're in the right place. We thank you for joining today. For those of you who have not met me, I am Adrienne Griffin, the Interim Executive Director and Vice President of Program. So it's my pleasure today to speak with you about this current opportunity. I'll be joined by two colleagues as well, Roberto Bacalski and Numa Harrison. We're going to tag team it today to try to keep this interactive and lively. We'll also invite you during the second half of the informational session to answer pose any questions, and we'll give you any answers that we can. So let's go ahead and get started. We are going to record today. That recording will be available to you. We'll also be taking notes, and those notes will also be available to you as well. So fear not if you have colleagues that would like to also see this informational session or benefit from the notes, we'll share those as well. All right. So this is a 2-year opportunity really to go to scale. We have $2 million available to you in 2 different categories. So I'll talk about those categories in just a moment. Just wanted to give you an overview of the spirit of this particular call for proposals. We're really building on the past work of the Reimagining Nursing Initiative. We've had 3 different focus areas for that initiative. One is focused on making sure that nurses are practice ready. The second is really emphasizing the importance of nurses being reimbursed for their healthcare expertise. And the third is application of nurse-driven technology, making sure that technology is helpful in terms of uplifting nursing overall. So this is a 2-year opportunity. We really want to focus this funding on leveraging these 3 focus areas of the Reimagining Nursing Initiative, but also growing it, looking at all of the different settings where nurses come into play for healthcare of patients and really thinking about that patient journey. We're looking at settings in a very broad way. So the RFP articulates 4 particular settings, but those are not only you're not only limited to those settings. So it's everything from community health, home health, to acute care, ambulatory health. Any type of setting where nursing might be practiced would be eligible for this particular opportunity. Our big idea is to uplift nursing to realize a healthier world through the power of nursing. So we have 2 different funding categories for this particular RFP. Category 1 is for what we would say are new folks that have not yet been part of the initiative in the past. Nurse-led teams that are interprofessional or interdisciplinary in nature are welcome. This category has a range of grants that could go from the ceiling of 500,000 and range down to 250,000. So it's a range of 250,000 to 500,000 for this first category. And we do that because we are looking for opportunities that can go to scale. You might say, if we wanted to propose something that's far less, would that be okay? And I would say that this is not your opportunity. We are looking for awards in the range of 250,000 to 500,000 because we want to see efforts go to scale over a 2-year period. And we feel that that level of investment would be necessary to help get nurse-led interdisciplinary teams to that finish line. So that category 1 focus and purpose is to make sure that we're seeing nurse-led interprofessional teams that have not yet enjoyed dollars from the Reimagining Nursing Initiative. Category 2 are for current grantees. So these are current grantees of the Reimagining Nursing Initiative. And we have either 1 grant at 500,000 or 2 grants at 250,000. So it's up to you to delineate in your budget response what level of funding you would like to request, but that is the ceiling. We cannot go above 500, and we do encourage the floor, if you will, to be around 250,000 because we want to make sure that these dollars are able to really help achieve going to scale within that 2-year period. Again, that lead entity for category 2 needs to be a current Reimagining grantee. We will look for that. And of course, we encourage nurse-led interprofessional, interdisciplinary teams as well for category 2. Other than that, also we just wanted to note that there is some flexibility for you to partner with other colleagues across the categories. I'll give you a couple examples. So let's say organization X is a new kid on the block, not yet funded. You might apply in that first category for new grantees. However, you might have been brought in perhaps as a consultant for a category 2 opportunity. So likewise, if you are a current grantee, you would apply under that category 2. And you might then also be a partner of a larger effort on a category 1 initiative proposal. You are allowed to be part of a team. We just don't want the same primary applicant to be in each category. So, and I'm seeing some questions pop into the chat. Yeah, so keep them coming. Thanks, Roberto, for responding to that as we go along. Yes, it's one or the other. We have a ceiling of 500,000 for current grantees, and that could be either for one grant at 500 or 2 at 250,000 each. The most important piece will be to be responsive. We'll be rated on 9 different criteria points. And so I will invite my colleagues, Roberto and Numa, to share just a little bit more in terms of those key criteria points, the key definitions, and then what type of documentation and evidence examples we'll be looking for. So I'll turn it over to you. Thank you. And then I'll take over on the chat responses.
Hi, thank you so much. And thank you, Adrian. Hi, my name is Roberto Bacalski. I am the program manager for the Reimagining Nursing Initiative. Let me see. I'm not sure my video is showing up. Let me just spotlight myself. All right, I think you can all see me.
Yep,
Great.
we can see you.
Okay, perfect. It shows up differently on my screen. Someone just asked, how do you know if you are a current recipient of the Reimagining Nursing Initiative grant? If you don't know, then you're not, because there were only 10 recipients of that first phase of funding, and we have been working with them over the past 3 years. So if you don't know, then you are not. If you are, you've known for 3 years and have gotten to know the other recipients very, very well. So anyway, I'm going to go over some of not some of the 9 criteria points. These are kind of the non-negotiables of your project. I'm going to share my screen. Give me one moment here. Okay. Can you all see this? 2-year opportunity to go to scale. Applicants must address the following criteria in a response.
We can see it now. Yeah, we can see it now.
Okay, great. All right, so again, these are non-negotiable. Your project must meet all 9 of these criteria. We're not going to give a grant to someone who meets 7 out of 9 or 8 out of 9. All 9 must be present. And I'll just go over them right now. So the first criteria, we must know, what are your lessons learned? And the definition of that criterion is that we have to see the application and use of a framework for problem solving, such as action learning or plan, do, study, act cycles, a clear articulation of the problem that you are solving, and a plan for integrating learnings from previous work. And that part is very important. We are not looking for building a concept from scratch. or something that currently exists in your head or on paper, and you've not grown the project at all. We're looking for projects that are at a certain level of maturity and ready to go to scale. So we want to see what have you learned, what challenges have you overcome, what mistakes have you made that you learned from, how did you learn? So we want to see what the track record of the project is. Examples of how you would show us that would be a problem statement that describes what your effort is solving, a narrative description of the problem-solving framework, a work plan that integrates lessons learned, past achievements, and a learning-informed template for change, playbooks for future efforts, or an evaluation plan. Again, those are just examples of how you might show what your lessons learned are. Those aren't the only ways to do it, but we do have to see what are your lessons learned. Second criterion is it must be bold. And what do we mean by bold? We mean that the effort is edgy, it's different, it's transformative, it's future-oriented, it's forward-thinking. Most importantly, it's a change from the norm, not the way you've always done things, staying relevant. We want something that has not been done before on a wide scale. And we're not talking about scaling an existing technology. For example, if your project is to make telehealth accessible to people living in rural Alaska, that is an absolutely noble project, worthy, and I hope it comes to fruition. But that's not this project. We want, because telehealth is an existing technology. We're not looking to create access or implementation of something that already exists. We want to see something that doesn't exist on a large scale in the market right now, and that you are creating. And the way you might show that to us is short videos with key informants or change agents. You might show social media posts that you've made, showing how this is a bold new idea. Again, those are just examples of how you might express the boldness of your project. It has to be equity focused, and that means it has to be broadly supportive of the principles of diversity, equity, inclusion, and accessibility. There has to be development of leaders at all levels across different settings. We want to see leadership development as part of your project. It has to reflect the journey of the patient, and it has to integrate nurse well-being. And what might that look like? It would look like something like continuous quality improvement approach to support leadership development across different settings. Or you might show how you're using the foundation's resources, such as our nurse well-being initiative, or Healthy Nurse, Healthy Nation. How are you integrating nurse well-being, and how are you reflecting the journey of the patient across settings, across demographics? How is equity being an integrated part of your project? Criterion number 4, it must be scalable. So it has to be existing work that can continue to grow. Again, not a brand new idea from scratch. We will want to see previously documented capacity and documented growth from the time you first started working on and implementing this project, and the data to support that growth. And that can look like a narrative description. It can look like data summary tables. It could look like interview summaries with key informants. Number 5, it must be nurse-led. We are all about interdisciplinary teams, but the work must be led by a registered nurse. If an MD is the PI and the RN is a co-PI, that is not nurse-led. Nurses must be driving the work and leading the team. Again, you can have an MD co-PI, or a public health PhD on the team, playing an influential role, but the people driving it must be registered nurses. And again, integrating nurse well-being, that has to be a priority, and showing that you are developing leaders at all levels. So some of these criteria do overlap. So what would criterion number 5 look like? What would we be looking for? You can show us in a capability statement. The staffing roster and bios will tell us, who is leading the team, breakdown of the staff responsibilities, percentage of involvement, that sort of thing. Staff and program plans, continuous quality improvement approach to integrate nurse well-being, supports for leaders at all levels, and how you're engaging nurse leaders from staff training to preceptor. Those are examples of how you can show that it is nurse-led. Criterion number 6, we want to see what your outcomes have been. We have to show us outcomes that already exist. So show that your proposed work builds on previous process outcomes. What outcomes have you already achieved that can now be taken further? We need your proposal to demonstrate the impact on how this work supports nurses at all stages of their career, including students, how it affects patients, and how it affects the greater community. We also want to see outcome measures that are rigorous and represent a balance of quantitative and qualitative measures where feasible. What that might look like, examples of how you can show us your outcomes is an executive summary of past outcomes, both qualitative and quantitative, or a clearly articulated evaluation plan that captures the outcomes and metrics. And I say or, I really mean and or. These, like I said, these are examples of how you can show that. Criterion number 7 is a demonstrated ability to scale. So you remember number 4 is scalable, and number 7 is demonstrate that scalability. So what that means is we want to see a potential for quick changes at the end of the 2-year time frame, including what changes might look like at the individual unit or institution level. What changes are you anticipating having to make? We want to see your ability to have pushed proposed efforts further than in past efforts. How are you pushing this project further to scale? If this is a new concept that is ready to scale, how have you built on the past efforts? What are the accomplishments that you can point to that you're going to be building on to bring it to scale? And the existing efforts, what existing efforts show the momentum and management of the proposed effort? And what that could look like in your proposal is documentation of 2 to 5 scaled efforts. What happened when the effort was scaled? What were the outcomes? What were the specific deliverables of that effort? And that can be narrative or graphic description. A narrative or graphic description of how far you think the proposed efforts can be taken within the 2-year time frame. We want these to be, we want you to be bold, edgy, but we also want a realistic prediction of what you believe you can accomplish in 2 years. This is, like I said, we want to think out of the box, but you need to be realistic and show us how your goals are realistic. Documentation of how the effort will demonstrate momentum. For example, changes not seen for 5 to 10 years are not acceptable. So we want to see what do you expect to see in 2 years. So we don't want to know if you're not expecting any real change or impact for 5 years, then this is not the grant for your project. So a lot of things take a long time, but we're looking for what can you accomplish in 2 years. And that can look like a narrative graphic description of the proposed effort and how it might address areas of synergy with other concept ideas. The criterion number 8, communication of evidence. So we want to see effective use of storytelling. Data is absolutely important and necessary, but what is the story told by your data? How will you just share your findings? Whether through journal articles, conference presentations, or or pitching the ideas to the market, to commercial interests. And that might look like, what are the publications that you have already, what have you already published on this, about this project, in either professional publications or, please excuse the typo, professional publications or lay publications, mainstream publications like newspapers, Newsweek, New York Times, Washington Post, or like I said, trade publications or academic journals like Nursing Outlook, the Journal of Professional Nursing, Nurse Management, things like that. You can show us videos on how you've shared your findings and how you've tailored the information for different audiences. And finally, criterion number 9, we want to see an ability to continue your efforts. How our funding is a catalyst for new work. How does this funding support exploring other funds? And how is the effort self-sustaining? How is this going to, it can't become the norm in nursing or in healthcare unless it's self-sustaining, self-funding. So we want to see that you're looking to, when we ask about your sustainability plan, we don't want to hear that, well, you'll be continuing to apply for grants. No, at a certain point, to be scalable, it has to be self-sustaining. It has to be generating its own sustaining revenue. And what that might look like is you could submit a sustainability plan with specific measurements and milestones that you'll be looking for to prove sustainability. And just want to mention that all of these must be present. So they are numbered 1 through 9, but they are all equally important. It's all 9, or it does not meet the standard. It does not meet the scope if all 9 are not present. Numa, do you have anything to add?
Thank you for that. Well done, Roberta. Just a few clarifications. I will get to the questions. I see Adrian's already answering questions, but we'll clarify those. I think just wanted to touch on number 2. In terms of the bold, we mentioned like you cannot use existing technology and wanting to scale existing technology or ideas. You can integrate. So for example, if your idea is big and bold and wants to work with current existing EHRs to make something accessible, you can integrate existing things, but the existing thing cannot be the idea. So I just wanted to make that clear. So existing things can be integrated into your idea. And then also just wanted to encourage people just to think of, when you're thinking about equity and diversity, inclusion, what that means. I want to encourage people just to think broadly about what that means. Sometimes equity and inclusion can mean geographic equity or inclusion. It doesn't have to be, I think sometimes we can be limited in how we think of what that looks like, but it's good to be specific, but be bold and inclusive. It can include different types of learning, or like I mentioned, geographic areas, economic diversity, all of those things. So really think boldly about that. And then also, just because I know, and most of the people here, if not all, are nurses, or are here on behalf of a nurse who's going to be leading this project, really just encouraging, there's a lot of emphasis on this, on 2 things. 1, outcomes, and the evidence. We know everything that we do in nursing has to be evidence-based, evidence-focused, so really having broad ideas, big, bold ideas, but really be specific about the evidence of what you've already done, how you've done it, what outcomes, very specific outcomes. I think it's important that when we're doing this kind of work and we're going to the world with big, bold ideas, that people can actually measure and see very specific changes in a short amount of time. So that there's no risk for like no credibility, or like where is this coming from. That evidence-based work is what we all know matters in nursing, and it matters in this space too when we're innovating. And I think that was it that I just wanted to add. Yeah, I think that was it.
Great. All right, good. Well, thanks, Numa. And thanks, Roberto. So next, I wanted to go over the timeline. A couple of you were already asking about that in the chat, so I went ahead and popped it in there. I'll also just share the link to the grant portal because a few of you were asking for that here. It is linked within the press release, but I understand it might be unwieldy to go through a whole release to get to that. So that is also in the chat now too. So with today's call under our belts, we'll look forward to the actual submission deadline. That is January 10th at 4 p.m. Eastern Time. We're not going to do extensions. So that is important to note. We're serious about that deadline. So start your submissions now. You can in the portal save your work and come back to it. So feel free to start getting in there, tinkering, getting your teams together, and note your applications in the proper category. The review of the applications, we anticipate doing that throughout the month of January, February, so that by end of March, beginning of April, we'll be able to notify you of hopefully your good news. And then our vision for this is for you all to have notifications and the grant agreements in your hands for May Nurses Week, which is that second full week of May. So that's what we're aiming for. And then the grant time frame, you will have 2 years because it's a 2-year opportunity. So starting in May 25 through the end of April 2027. That's the time frame that we have for this opportunity. Now, wanted to just go over a couple other eligibility criteria for this opportunity. We do have this open for nonprofit organizations as well as for-profit entities. The only caveat is that this is not meant to do anything other than cost recovery. So if you are a for-profit entity, you can apply, but you need to understand that we will want to see these dollars accounted for and only used for this particular work, and we'll want that accounting done separately. So just keep that in mind. A couple questions had come in about that already, so I wanted to specifically address that before we open it up to questions. I just have a few other points, and then we'll go ahead and open it up to your other questions, but keep using that chat, feel free. But then we'll also invite you to take yourselves off mute a little bit. Just a couple other points. This is a domestic opportunity. I've gotten some questions about, can this be used internationally? If you are an international entity, we are not authorized at this time to extend this grant. So want to just make sure that that is clear. It is a domestic U.S. and our territories opportunity, okay? We, of course, welcome teams that are diverse and really paying attention to diversity, equity, inclusion, access, and belonging. We really do take that seriously. In addition to the key criteria that Numa and Roberto just emphasized, we do also look for that to be one of your organizational ideals. Now, what can you expect in terms of support from the foundation? We really want this to be really focused in terms of ongoing learning. We want to support you and have check-ins, but in ways that really uplift the work you're doing and help you update us on lessons learned, but more importantly, to help drive the work forward. So we'll have just a couple calls over the course of the year, but we'll also expect for the good work and the knowledge that you're evolving through this initiative to be shared with other grantees across our portfolio. We do this through principles of action learning. Really, all that is a way to take a strategic pause and reflect as you go so that we're able to pivot according to what you might be learning and then make use of those learnings in the next phase. We don't do this in a way that would jeopardize any publications or any types of conferences or abstracts that you might be submitting. It's just in terms of sharing lessons learned. So I wanted to emphasize that. We're also looking at how this particular opportunity can inspire other leaders across nursing. So not everything needs to happen at that CNO level. There's leaders at all levels. And so we'll also be collaborating with the awarded grantees on how to cultivate leadership development to really go to scale and continue with the good work that they're doing. I think beyond that, wanted to just talk a little bit about the mechanics of the narrative. We overall, I would say less is more. We do have the specific pieces of the proposal sections. We will hold you to those, the character limits. We won't want to have too much more than that, nor do we want too much less than those limits, right? Because we want you to fully articulate what it is you're doing. There'll be an abstract section. That abstract section will be utilized in a number of different ways for the foundation to cross promote. So just know that that will be something that is not considered confidential. So if you write it in your abstract, you will see it again in other forums such as a press release or our website. So I want you to keep that in mind as you're developing that section in particular. Otherwise, do pay attention to the criteria in the proposal response sections. We do want to have a good overview of your project narrative with the background, aim, and your methodology really clearly articulated, as well as the timeline. We do want to, as Roberto said, see this happen within 2 years. If you put in a proposal and say, we're going to have something great in 4 years, this is not your opportunity. Okay, we are looking for a 2-year turnaround, and again, alignment with those 9 key criteria that we have shared. We're also going to want to see that team overview composition. We want to see that it is nurse-led. That's really important, and to make sure that there's a sense of your team's interdisciplinary organization to support your proposal. We want to see that there's a match there. In terms of the budget, I would just encourage you to pay attention to the categories, make sure that the math adds up for whatever it is you are requesting. You'd be surprised at the number of times I've seen proposals over the year where it just doesn't add up. Someone will say, I'm applying for 500,000 and then the budget doesn't add up to that. So just align your budget accordingly, and make sure you're paying attention to the particular ask. If you are requesting a grant of 250,000, we're going to expect a budget with the corresponding categories for 250,000. We will want to see your personnel, your supplies, the equipment, the travel, other expenses, and your indirects spelled out. Now, in terms of indirects, we do have a cap on the indirects that you can allow for this particular opportunity. It's up to 15%. That's what we can have, and that is spelled out in the RFP, but I've also already gotten some questions about that. That is what it is, and it's not included in your, it's exhaustive of outsourced services. So it's 15% of the project costs, okay? Other than that, just looking back at my notes here, those were the pieces that I wanted to make sure we said to you out loud. Let me pause here and ask Noma or Roberto, is there anything else that we wanted to say out loud before we opened it up for questions? Am I forgetting anything?
Not that I can think of.
Okay.
But I'm
No,
sure.
I think you've covered just about everything that I could think of. And if you have a question that you would like to ask out loud, please use the Teams window to digitally raise your hand. And when you are called on, go ahead and take yourself off mute. Otherwise, please keep your microphone on mute.
So Patrice Little asks, what is an indirect? An indirect rate example would be it's a percentage or a fee that you're able to apply across an award. Many times institutions will take that to really help offset some other costs that you incur really just for doing your own day-to-day work. So I hope that's helpful, but there's a whole body of literature around indirect costs as well, but that's in a nutshell what it is. And our cap for this particular RFP is 15%. Many times other institutions or universities will have a much higher indirect rate. For this particular award, we need to see that capped and no higher than 15%. You can go lower, but no higher than 15%. Sure. And I see in the chat, Tiffany was asking, we would be able to get an example of a previous successful use of this grant. I would say check out the 10 pilots in our Reimagining Nursing Initiative. Although that said, it's not an totally 100 apples to apples comparison, because this level of funding is a bit lower and the timeline is a bit tighter. We've really are looking for this to be a more specific 2-year opportunity to go to scale. But you can get some ideas of what past grantees have done through the publicly available information on the Reimagining Nursing Initiative page.
And I'm going to put that link in the chat right now.
Awesome. Thanks, Roberto. For those of my friends here on the phone, you should be able to take yourself off mute if you hit *6 if you want. I know you don't have access to the chat, so that's why we're voicing it, so that you can hear the questions that way. But if anyone who's joining us over the phone would like to ask a question, you can hit *6 to take yourself off mute, voice your question, and then I would just ask that you put yourself back on mute as well, so we don't hear any background noise, and you would hit *6 again.
And in terms of examples of what this could look like, I think that part of it, we want you to use that reimagining, look at previous work and get some ideas there, but don't limit yourself. I think we've put a lot of time and effort into giving examples, and when you get into the RFP, it will kind of guide you through shaping out your idea and what's required of you, and as you're thinking about it. So I think a way that works for me is to really look at, we want work that's already been tried, you've experimented, you've had a project, you've had some outcomes, lessons learned. Think about what you have done or things that you have tried and worked with that have been successful and can go to scale, or just needed more money, more funding, and can go to scale through an opportunity like this, and then go into the portal and see what this is requiring of you, because there might be opportunities there for you to figure out how you want to shape out this new big, bold idea that you have. Once you get into the portal too, there's a PDF that you can attach. Somebody asked earlier, you don't have to complete everything in one sitting. There's a PDF that you can download, which will show you everything that's going to be asked of you in terms of like, how do I write this out? What is required? What is this asking me to write about? And really take some time and get creative, think about your responses, and then come back in and you can sit down and populate the portal with your responses. But it'll guide you on what's being required and what's being asked of you, so you can shape your ideas according to that guidance. I hope that's useful. And I know sometimes it's like, where do I start? But we've really worked hard to give you a lot of criteria. Plus, we're available to answer questions. We can't specifically guide or give you examples of what to do with your specific idea. That is not what we're here to do, but we can support if there's something missing, or if you still have questions, much like the ones we're getting today.
Thanks, Numa. And I noticed there was a question earlier in the chat that I missed. The question is, how many awards will there be in Category 1? So for Category 1, we have a total budget of $1.5 million, and we have that open for those grants to range from either as low as $250,000 all the way up to a cap of $500,000. So if we were to get 3 finalists that each requested 500, we could do 3 at 500, or we could do 6 at 250, or some combination thereof. That will be one of the opportunities, I'll say, for our reviewers to advise on which proposals rise to that level of funding. But our cap total budget for Category 1 is $1.5 million, and that would be at max 3 at 500,000, or if they were at the lower 250, 6, or a combination thereof. Could be 1 and 4. You get the idea. So thank you for the question. Just pausing in case anyone wanted to take themselves off mute. Again, if you're on the phone, you could hit *6 to voice a question, and then *6 again to mute yourself. I see a couple of you are on the phone, so I just want to make sure we're accessible.
I'll ask another question. This is Janine Brandt from City of Hope. You talked a little bit about the boldness of the intervention and telehealth, and yet integrating technology. So it's not like you can we can still consider existing technology, but we have to do something different and unique with it. Is that kind of the idea there?
Yes, yes, that's the idea. We're not looking for something to just be rehashed that's already been out in the world, but maybe there's a unique spin on it, or there's some kind of unique application to it that has not yet been done in a nurse-led way.
Yeah. If you look at the existing Reimagining Nursing grantees, you'll see examples of that. For example, one of our grantees has developed an early warning system that integrates with the existing EHR. So EHRs are obviously existing technology. However, this tool that integrates with them and predicts patient deterioration, that's the innovation. That's an innovation that hasn't existed yet. I mean, early warning systems exist, EHRs exist. This is an early warning system that does something completely different that hadn't existed before. Another one is using robots to assist nurses with a more mundane task that they do. Robots have always existed, or at least for the last, I don't know, 70, 100 years maybe, but they have never been used in this way. So that's what we mean by using existing technology as opposed to scaling something that has already exists and just needs to expand, like telehealth.
Any other questions?
While we wait on questions, can I also double click on something else? The well-being component, I think that's a very new thing for this round of Reimagining Nursing proposals. And it came up when Roberta was scrolling through the screen in criteria number 3 and criteria number 5, right? And that's intentional. I think we want to be very, very intentional that these ideas that we're putting to market are not thinking about the well-being. They might be solving a problem in healthcare or nursing, but what is the impact on the well-being of the nurses? We really want to make sure that is front and center, that is not an afterthought, right? Like we came up with a great new innovation, but it's putting more work, more stress on the community or on nurses or something else. So really be clear, and I want to encourage people to think and be thoughtful and very clear about what that looks like, right? Like I think for many years, and this has been a part of our problem and what we've suffered greatly in nursing with, is well-being has come later, right? So really think about innovation, but put well-being at the center of every idea and how and what that looks like in a measurable way too, right? Like how do we know that people are better off, that nurses are better off because of this new idea that you're having? How can that be measured? What will that look like? Right.
And I just popped the link to the nurse well-being building peer and leadership support program that the foundation has in the chat. Can we use offshore contractors? Blanche, I appreciate the question. US-based dollars is this opportunity. So if you have a prime that is in this country, that's what we're going to want to see. Okay. One other point I just wanted to clarify is that the sponsoring institution, you'll need a note in the portal as well as the RFP reviews this, but you'll need a sponsoring institution noted in your cover letter. Your cover letter won't count against your character limit. So wanted to let you know about that, but that does need to be noted. And some entities that are for-profit or government entities are looking at getting a nonprofit partner to serve as that prime sponsoring institution. I mentioned that now so that you can plan and be in accordance with the official verification needed by that sponsoring institution. I know sometimes it takes time to get that in order, so I wanted to highlight that and draw your attention to it. If you are a nonprofit and you are employed at your sponsoring institution, that of course makes that process more straightforward and quicker. But for those of you that might be working through partnerships, because you are at a government or a quasi-government or a for-profit entity, just note that you will need that in your sponsoring institution backup for that cover note. Meant to say that earlier, and I just looked back at my talking points, so said it out loud. Any other questions or anything else, Roberto or Numa? Let's see. Question: when the indirect cost is added, should it be on top of the example? It would be part of the 500,000. It is inclusive of the award. Good question.
Mm-hmm.
Sure. It's not you request 500 and then say plus 15. It's within, all within. All right. Well, then I see Roberto putting our emails into the chat. Please feel free to reach out to any one of us with any questions that you might have. We will be making a copy of this discussion as well as notes available through the grant portal. We hope that this is helpful, and we look forward to seeing some fantastic proposals from you all. Nurse-led teams. Thank you all very much.
Thank you,
Yes.
everyone.
Thank you.
Hello, is anyone here?